Okay, good afternoon from Bergen, everybody. I have the pleasure to introduce Tanya Doherty. She's a professor at the School of Public Health, Cape Town in South Africa, and she also is affiliated to Medical Research Council in South Africa. Tanya has done a lot of community-based interventions, embracing cohort studies, trials, and also country evaluations across Africa, and published more than 100 papers. And she, as said, holds position both places. She will take us through the keynote lecture, how marketing of formula milk influences health professionals and communities, and why we should be concerned. And this builds on a topic which we have discussed today in our part of the food insecurity course, where we have looked in depth into both the influence of industries related to sugar and also formula today, and the role that many of us in research and also within the health system, also to the really community-based elements of the health system, may play in actually promoting kind of recommended nutrition practices and also prevent a poor health. So welcome, Tanya. And I could say maybe the floor, or at least the screen, is yours. And I don't see your camera on, but I will turn mine off and my microphone off when we see you are ready.
Great. I'm just going to try and share.
So here we have students from 6 different courses that have joined the Bergen Summer Research School this year. So now it's in that's the correct version. All right, perfect. Then
Thank you. Good afternoon, everybody, and thank you for the invitation to talk to you this afternoon as part of the Bergen Summer School on the topic of formula milk marketing. So, as you've heard, I'm sure, throughout the course around infant and child nutrition, feeding practices of children in the first 3 years of life profoundly affect their survival, health, and development. And this occurs throughout the life course. Infant feeding is important because we have incredible information and evidence around the impact of breastfeeding in prevention of childhood deaths, particularly from diarrhea and pneumonia. We know that appropriate breastfeeding practices can prevent childhood obesity. And importantly for women, breastfeeding has an impact on deaths from breast and ovarian cancer. So over the last 2 decades, we've seen very, very modest improvements in both exclusive as well as continued breastfeeding across wealth quintiles in populations. And there are many reasons why women might choose not to breastfeed. And these can include personal preferences, constraints within the work environment, access to maternity protection, an important constraint, and reason why women either do not begin or end breastfeeding early is the perception of insufficient breast milk. Many societies, there are norms around the early introduction of top-up, particularly formula milk. We also face health systems in which women receive inadequate support to breastfeed, and many other reasons. This figure shows the per capita increases in sales of formula milk for 190 countries. And between 2005 and 2019, the sales for growing up, follow-on, standard and special formulas increased by 64, 77, 214 and 95%. Yet, over the same time period, in 83 low and middle income countries, breastfeeding rates increased by only 25%. The commercial marketing of formula milk products is one of the most underappreciated influences on women's decisions around how they feed their children. In 1981, the International Code of Marketing of Breast Milk Substitutes was adopted to regulate the marketing of breast milk substitutes. And this represents the collective will of the World Health Assembly and its member states. But 40 years on, formula milk marketing is widespread and it is aggressive. At the start of this talk, I really feel it's important to frame this issue because this is about marketing. It is not about the product. We know that there will be instances, and WHO has guidelines for instances where infants cannot receive breast milk. So what we're talking about here, and the concern here, is for the marketing, not for the product. Another important issue is that this is about the right of women and families to receive accurate and impartial information and support. Decisions around infant feeding should not be influenced by commercial interests. They should be based on accurate and impartial information. And this issue is about public health interests against commercial interests of companies whose primary purpose is to increase sales and to generate profit. So through this talk, I'd like to present some research. Some of you may have attended the launch of a multi-country report that was commissioned by WHO, undertaken in 8 countries in all regions, all WHO regions, including in South Africa. The data for this study was importantly collected by a global marketing company, MNC Saatchi World Services. This was a deliberate decision on the part of WHO not to hire a public health research institute to undertake this research because they really wanted to understand the marketing approaches and tactics, and a marketing company is best placed to do this. So the study aimed to document the reach of marketing, how the marketing messages are perceived by women, as well as health professionals, and the impact of these marketing messages on women's and health professionals' knowledge and values. The secondary study aim was to learn from these marketing approaches that are used so successfully to promote formula in order to adopt some better marketing approaches, because we're not very good at marketing breastfeeding, but to use some of these approaches to support women and to better promote and support breastfeeding for mothers and communities. So the study design, since this was done by a marketing company, used a consumer and market research design approach, something that would normally be adopted to inform a marketing campaign. And so convenience methods were used to recruit groups of the population across these 8 countries, including women and health professionals in urban cities, which is where trends in values and beliefs usually start. So there were surveys of over 1,000 women in each country, including pregnant women and mothers of children under 18 months. There were interviews with mothers and health professionals, and mothers kept marketing diaries for a period of 7 days, documenting the marketing that they came across in their daily lives. Importantly, what the study found was that across all 8 countries, women expressed a very strong desire to breastfeed. And this ranged from 49% of women in Morocco to 98% of women in Bangladesh. But marketing messages reinforce myths about breastfeeding and breast milk, and these were frequently repeated by women. And these included the necessity of formula milk in the first days after birth, the inadequacy of breast milk to sustain infants, the perception that formula keeps babies fuller for longer and therefore they sleep for longer, and that the quality of breast milk declines over time. So of the over 8,000 pregnant and postnatal women surveyed for this study, just over half had seen or heard marketing for formula milk in the preceding year. And this ranged from 97% of women in urban China to 84% in the United Kingdom, and on the lower end of the spectrum, Morocco, at 3% of women who had seen marketing messages. Television was the most common media for marketing messages, and it was particularly high in Vietnam, with 86% of women seeing adverts on television, 72% of women in China, and 68% of women in the United Kingdom. Other important channels were social media and supermarkets. There is a quote from a mother which really reinforces the advertising and brand recognition that is created through television adverts. And she said, "When I was in the store looking at so many, I recognized Nan. I feel like it's got more of a presence, especially on TV, and that's why it stuck in my memory. And that's why I felt safe going with Nan." So the constant adverts on television are creating the brand recognition. And so women are attracted to certain brands when they're in the supermarket. The marketing is highly personalized and is using multiple channels and approaches, particularly social media platforms, digital influencers, talks and events, direct interaction between company representatives and women and health professionals, and I've already mentioned television. Social media channels are unfortunately often outside of the remit of regulations within countries and often inaccessible, and because traditional media is much more overt and easy to control. But digital marketing provides companies with a rich stream of personalized information that they can use to sharpen their messages directly to women. Women reported being contacted consistently with marketing messages, particularly pregnant women who signed up to baby information sites and clubs, online clubs. And marketing was also prompted by search strategies. If a woman searched for information on breastfeeding, she would then start receiving a constant stream of adverts for formula milk. A relatively new form of marketing are influencers. Influencers are people who generate income from companies like breast milk substitute companies by creating content and generating followers. So these followers are usually people who respect or admire someone who's a film star or a celebrity, and they then follow their posts and are influenced by what they post. And they're paid to publish content that promotes products and brands. And women often follow particular influencers and are then affected in terms of their purchasing decisions. Often there's promotional behavior and competitions are used to promote products. So here there's an example of a company that would like you to post pictures of yourself with your baby in order to stand a chance to win an iPhone 12. And this type of promotion really encourages women to join these online communities. And the enticement is then the opportunity to win products and receive rewards, and particularly discounts on purchasing of products. So the marketing diaries of women produced these kinds of images that they would take when they were, for example, in a supermarket. And here you see a tactic used by companies known as cross-promotion, whereby they make all the products look exactly the same so that they can market products that fall outside of regulations, which in most countries only cover products targeting children under the age of 3 years. And so the older stage milks are allowed to be marketed, and the companies then market them under the same umbrella brand, the same packaging, and make them look identical to milks intended for children under the age of 3 years. Exposure to marketing was found to be related to the belief that formula milks are necessary, especially for older children, aligning with the belief that breast milk quality decreases over time. And in all surveyed countries other than the United Kingdom, 80% of women who were aware of a stage 2 formula product believed that it was necessary. This is another example from women's marketing diaries, where the price reductions, which are allowed for stage 4 milks, were strategically placed underneath milks intended for younger children. Again, an example of a form of cross-promotion. What the study also found was that science is a dominant theme in the marketing, including scientific imagery, language, and pseudoscientific claims. Formula products are being positioned as close to, equivalent, and even superior to breast milk, and scientific evidence is misused to infer improved health outcomes. There's a huge growth in new products that focus on allergies and sensitivities, which is one of the biggest areas of growth in sales currently. So in South Africa, women were asked how they made their decision on which brand of formula to use. And a third of women chose a particular brand of formula because they believed it was the closest product to breast milk. And this aligns very closely with the messages that appear on the packages. An alarming number of women recalled and had beliefs around formula that were related to misleading scientific information and claims. Importantly, that formula helps babies sleep better, that it keeps them fuller for longer, that it provides the same health benefits. 50% of women believe this, and 49% that formula is very much like breast milk now. So we found across countries there was a lot of contact between companies and health professionals, including within health establishments, within hospitals and clinics. And as this mother explained, it was a doctor who told me I should use Pelargon, a brand of formula from Nestle. And the doctor was saying that if you're not breastfeeding and you're giving this particular milk, it's tantamount to giving breast milk. So the marketing messages have really influenced health professionals to such an extent that many of them held the belief that formula was now equivalent to breast milk. Across countries, many women actually received a recommendation to introduce formula early from a health professional. And in Bangladesh, it was 60% of postpartum women, and in Nigeria, 45% had been recommended to use a product by a health professional. These two quotes are from health professionals in South Africa. And in South Africa, we have a unique public and private healthcare system. And particularly the private for-profit health system is much more influenced by industry because it's a profit-driven system. And the hospitals themselves can accrue kickbacks on their sales of formula products. And so this general practitioner explained, I see the representatives a lot. I see 3 of them regularly, and they push their products through me. So there's regular contact from the representatives coming in to practices and hospitals and selling and promoting products. And a nurse within a hospital said Nestle would give in-service training every 4 to 6 months about the new types of products and the benefits. And this was found to be very widespread, particularly in South Africa. And as a result, the beliefs of health professionals had then become very well aligned with these marketing messages, indicating the success of these marketing approaches. As this nurse said, we're telling them, mothers, that nowadays formulas are made really exactly like breast milk. And another nurse, in fact, in the public sector said, formulas have ingredients that are very close to breast milk. They've got almost the same amount of nutrients. Formulas have gone that far. So the marketing was really very successful in influencing the opinions of health professionals. But importantly, South Africa is one of only a few countries globally, I think less than 20 countries globally, where our legislation is very closely aligned with the code. And so in our public sector, since the regulations that enact the code in South Africa were introduced in 2012, we now have managed to prevent contact in the public sector between company representatives and health professionals. And this nurse explains that before, their reps used to come often into the health facilities, but now, since the regulations, they're not allowed into health establishments anymore. Another impact of marketing was around the early introduction of formula in the first few days after birth, and the belief amongst health professionals that colostrum is not sufficient for newborns. And this perception of this general practitioner was that the baby has to have a formula top up. There's nothing you can do. And a pediatric nurse described that she believed 6 out of 10 women struggle to breastfeed, and therefore they have to introduce formula. And once they start, they will ultimately continue. So there was the recognition that once you introduce this in the first few days after birth, it's likely that the mother will continue with formula when she's discharged home. What we also found in this research was that companies are using the so-called formulas for special medical purposes as the solution to common, normal, early newborn behavior. So they are exploiting mothers' insecurities, firstly about having enough milk, and framing normal behaviors like crying and short periods of sleep in newborns as pathological. And this private practitioner who had been in contact with company representatives was explaining that there's a formula for regurgitation, there's a formula for colic, for crying, for gas, for constipation. So really, these products are being marketed as the solution to absolutely every kind of newborn behavior. So health professionals have personal, trusted access to pregnant women and parents of young children, and they have a trusted role in providing evidence-based, independent, impartial advice and information. But the systematic marketing by companies is seeking to influence health professionals' understanding of breastfeeding, to convince them of the need for formula, as well as to use them as channels for marketing. So marketing of formula today is highly advanced and targeted, and we have multiple social media avenues that can largely go undetected that enable companies to reach women directly. Insidious marketing of formula is widespread, and it is exploiting mothers' anxieties and their aspirations. It also serves to undermine confidence and perceived value of breastfeeding. So the marketing of products is everywhere, and this is despite the manufacturers stating that they are aligning with the code, which is clearly not happening. So why should we be concerned? Formula milk marketing is different from the marketing of other products that we encounter on through our daily lives. And it's different because how we feed children impacts on their survival, their health, and their development. And it also has impacts on women. The marketing of formula milk disrupts access to impartial and truthful information and the right of parents to receive accurate support and make decisions. And this right is actually enshrined in the Conventions on the Rights of the Child, that the child has the right to the optimal nutrition and that parents have the right to accurate and impartial information and support. The marketing of formula milk completely disregards the International Code of Marketing of Breast Milk Substitutes, which represents the collective will of the member states of the World Health Assembly. And it exploits aspirations, vulnerabilities, and fears at the birth and early years of children for commercial gain. So there are opportunities for action. Only 25 countries globally have legal measures in place that are strongly aligned with the code. And these are the countries in dark pink on the map. So there is a huge amount that can be done at a country level to enact legislation and to enforce that legislation. So we need to sensitize health professionals, dietitians, public health professionals, people involved in infant and young child feeding to the code and local legislation where you are working. This is urgently needed, and we need this not only in our pre-service training, but also in in-service settings. So as health professionals, we can become champions to enforce the regulations and not channels for marketing on behalf of companies. We need to explicitly reject formula marketing and influence in healthcare settings so that health professionals can provide families with honest information and support. And importantly, preparing women for normal early infant developmental behaviors like crying, like positing, like short nighttime sleeping, normal infant behaviors. And the misconceptions about the equivalence of formula to breastfeeding should be corrected. And as health professionals and public health professionals, we should speak out against misleading industry pseudoscience, and we should not accept funding from the formula industry. Thank you. I would like to share a very short video just to end the talk, and then we can move into a discussion. I'm going to stop sharing so the video can be shown.
Not yet started there.
Thank you.
Thank you, Tanya. Thank you for this very thought-provocative talk and overview of where we are in terms of marketing of formula milk. The code was released when I was still in primary school, and now as a professor, I see that quite a few of the problems that was seen in the early 80s are still there. It's kind of just comes in new shapes, in new in new clothing, in new appearances. And I think everybody that has published a single word about breastfeeding has been approached by one of these giants with very kind of tempting invitations. I invite the audience to write questions or comments in the chat. People are say a bit of thank you already, but if you have more kind of explicit questions, you can post them or raise your hands, and I will share a discussion. We have to close by 1400, and I might not see all the hands at the same time, because on my screen we have 3 pages with people. So if I don't see you, then try and also write something in the chat. But maybe just to start briefly, Tanya, I know you have worked a lot on these issues, and myself, I have done most of my research in Uganda. And I was just curious the other day when I was visiting Uganda for another purpose, just visiting grocery stores. And I saw that the price of 1 tin of a Nestlé product, I don't know which month, but most of it was around 40,000 Ugandan shillings, which is, well, I heard that the teachers in public primary schools earn around 450,000 shillings. So just around about a tenth of a teacher's salary for a tin. So to me, that sounds extraordinarily expensive. I wouldn't like to buy a single food product which costs a tenth of my monthly salary, particularly not a tin with Nestlé. So as part of marketing, have they done some type of price differentiation, or is it equally expensive everywhere?
So I think one of the really, really sad findings from this research was the extent to which women's aspirations are being exploited through the marketing, and particularly with the claims around intelligence and brain development and improved growth. And these are all the new kind of marketing messages and so-called special ingredients in formula that are making women believe that this is now a superior product in terms of their child's growth and development. And so, I mean, we're seeing across in the countries, including the study where there were some high-income countries, but we also had some, low and middle-income countries where the growth in sales is enormous amongst families who are already spending a huge proportion of their income on something based on false marketing messages and beliefs. And that's something that one of the big pushes in the taking forward the results of this research is a recommendation for plain packaging that really just has the ingredients and the instructions on how to safely mix the product, so that the pictures and the gold colors and the Opti Pro terminology that's used and gives the impression that this is so superior and is something that I really have to have for my child is taken out of that sort of decision-making process. So absolutely, the products are priced at a high level also to make the belief that this is really something absolutely superior that I need to have for my child.
Okay, there is, I mean, it's kind of, can I ask this? This is a very, this is a society here at the Bergen Summer Research School coming from really multidisciplinary and multi-contextual backgrounds. So I'm sure there are people here that have done a lot, for instance, on public taxes, like stuff like that this week, and know a lot about economy. Can we expect that the formula industry behaves differently from everybody else that wants to sell products?
Well, they are a profit-driven company, just like the sodas and the obesogenic foods, and they're operating from the same playbook. And so it's a really, really hard challenge, as we've seen and heard earlier with the sugar tax. And in fact, in many countries, because formula is considered an essential commodity, it's often zero rated for tax by the government as a way of increasing, the availability, affordability for families. So it's an extremely difficult one to tackle. And I think starting with health professionals, having that enforcement of the contact between companies and health professionals, the influence there is important. But, obviously we have to replace this marketing with active, genuine support for breastfeeding, because we can't sort of try and take something away and not replace it with what women actually really are lacking. And in fact, in the study we saw, most women actually really wanted to breastfeed and didn't receive enough support. So we have to look at the way that governments are investing in the support to enable more successful breastfeeding.
I think that's a very good point. We have two people here, and you may also feel free to speak out loud. We have a few minutes. So we have Nishad Nasrin. If you want to raise your question loudly instead of me reading, so I get it clear. I think you speak about the situation in Bangladesh.
Yeah, thank you very much. It's not a question, just contributing to the discussion. In Bangladesh, the context is really alarming, because many babies, that means newborn babies, are recommended to take not mother or breastfeeding of mother, and many of the households used to adopt the container milk, and that means formula milk, which is also a marketing strategy, which basically operating in Bangladesh. And I don't know if it's good or bad, but I think it's one of the case of that means ovarian cancer or breast cancer. Yep. And one thing I want to add, in Bangladesh, the rate of C-section, that means the delivery in the C-section, is quite higher. So in this field, so many options are available to research, and I can make a connection with this C-section and the newborn babies feeding, because when you I am taken into the C-section, then I may not be able to give proper feed to my child, newborn baby. So then people are seeking for help from the canned milk, that means the container milks, the formula milk, and the foreign companies are making profits there from that one. It's not humanitarian as well. Thank you.
Thank you, Nishad. I think that is well seen across many nations, that there is this kind of push in that direction towards both more than clinically needed C-sections, and that is also driving a need for a more formula, but also, as you see separately, that it's really promoted, as Tanya talked about. So I look upon that as a comment. We have 3 comments here from different people, other comments, and we have one raised hand. So if I start with Temito Adewale, yeah, you can also feel free to raise your question yourself.
So this question was around the maternity protection, and absolutely that is a critical part of an enabling environment for breastfeeding, because particularly in low and middle income countries, many women are forced to go back to work when their newborns are just a few weeks old, and we don't have the environments that are supportive of flexibility, of providing the requirements either to be able to continue breastfeeding, expressing, or having the flexibility to be able to go home or bring a child to work. So that is a key aspect of this agenda towards improving the conditions for breastfeeding. In terms of dietary products for women, yes, one of the key findings from this research that I didn't include here was around the growth in what they're calling maternal milk. So many of the companies are actually producing maternal milks, which they market as products for pregnant women, for their nutrition. And once you have got somebody started on a maternal milk, they're then aware of the brand, and that leads into the use of those products after the child is born. So that has been a new tactic in the last few years in this growth of these maternal milks, which absolutely are not a requirement for pregnant women to take a commercially made nutrient supplement like that. In terms of human rights and controlling these activities, you know, this is a very hot, sensitive issue, and where countries have tried to really introduce stricter legislation, there is a huge backlash around the rights of women, and this is seen as sort of a women's rights issue, the right of women to choose not to breastfeed. And I think, yes, absolutely, women have the right to choose how they want to feed their children. But what gets missed is that it's really about the way the marketing is being undertaken, that this is not really a level playing field. This is not women being able to choose with the best, honest advice and medically sensible advice. It's a barrage of marketing messages. And so I think when countries try and increase the legislation, they have to tread very carefully around these issues and frame the issue around marketing versus the product. So that is something that is a challenge as countries try and strengthen their legislation. If the code was discussed at the WHO today, would it look the same? You know, since the code was introduced, there have been quite a number of amendments to it. And it has to keep up to date. Every time we see different marketing strategies, different avenues, you know, that the whole digital social media space is something that the code is still trying to catch up with, because it's, you know, we live in a world where there's so much access to information, and so much of it is totally unregulated. And so trying to get, you know, a huge push is trying to get companies like Twitter and Facebook to also have a role to play in regulating the content that goes out, you know, through their products. And so there's a long way to go to navigate the space of social media, the protection of information, because, you know, people have access to us through our phones, through our computers. And so there is a long way to go. The WHO does amend and update the code fairly regularly. Every couple of years, there are new legislation, new amendments coming out. But there is still a long way to go before we can really fully understand the impact of some of the digital marketing techniques. The way to know that the ingredients is what is contained in the product. So there's a list of ingredients on the product, but then there are also, you know, the marketing slogans and terminology that are used, like Opti, Pro, Gold, you know, these kinds of words that suggest something that is superior for health. Human milk oligosaccharides is another. HDA is put across the tin and immediately gives the impression that there is breast milk somehow in this tin of powder. And so we have ingredients, but then we have very sophisticated ways of translating that into marketing terminology. And that is why the push for plain packaging is happening at a WHO level. And we hope to see that that's going to start filtering down and have some impact within countries.
Super. That was very good answers to very good questions. I think we have a hands raised, and that must be the last comment we can have from Griti in India. And then I think we express our thanks after that. Griti.
Not only research but a kind of revolution in itself. So it was really an eye-opening one, but I was thinking, can we have some community participation to it? Like we often say that community participation to sustainable development. So can we have like more women from the local community area where we can talk about, rather than baby formulas, we can come up with local dietary practices, which is because of the globalization, it's been pushed back, and we don't know what were the ancient practices which were healthy, right? Like in India, we give out lentil water to the child rather than giving baby formulas or something which baby can have, which is healthy. So we can bring on the local community, women or even men for that sake at the local level, and we can work together to give a tough fight to these baby formulas, and also ask our local in the hospitals, so doctors, that please don't do this, but please you can also like give out other nutritious way or suggestions to the people, or you can just say that okay, these local people are helping and you can go to them and they can give out some baby form, like not the baby formula but some local dietary thing, which is like reinventing the local diet, because in older days also we have babies, so what they used to give, so it's like bringing back what our mothers or grandmothers used to do.
And
something
it's a very good point, Griti, and we are really embracing wet nursing and milk banking these days, and we do hope there is a future for that, particularly for the first months for the very, very young ones, because then we do not recommend all sorts of other things. But Tanya, maybe you want to give a final comment and then we close.
Yes, thank you for that comment. And you raise a very important point about the importance of civil society action and community engagement in this kind of issue, because if we really want to see push for change, it has to come from communities, from mothers themselves, demanding that we take this issue seriously and enact change. So that's absolutely critical. Thank you.
I think we close. It was almost, I was almost keeping time. Thank you very much, Tanya, for this keynote lecture. It was wonderful listening to you again. We have enjoyed you in our course earlier today. And I just wish people a nice little break and continuation of the day. So I don't know whether BSRS are having any comments now. If